What is up, Element 26 family? How are you? We're talking about hips today, okay? So I have 3 strategies for hip pain relief, okay? And just, they can also be applied to keeping the hips in a healthy condition too, if you don't have pain. So let's talk about, to make it easier, let's focus on impingement or pain in the front of the hip, which typically comes on when you're doing a lot of like deep squatting or deep loading tasks where you're coming up into flexion, okay? So similar to what I talked about in the plantar fasciitis video, if you haven't seen that video is awesome. Check it out. It's somewhere in the feed on the side of your screen there. I'm going to talk about the 3 tips, which are rolling, stretching. This one I'm adding a mobilization technique to, and then stabilizing in positional drills. So there's a couple more things in here compared to what I talked about in the other video, but I want to make sure that they're all in the same category. So rolling, stretching, and strengthening or stabilizing, okay? So let's talk about the rolling first. Now, for rolling of the hip, what tends to happen is you get a lot of pain in the, say, the front of your hip because you're not able to shift into the side of your hip. I'll go over that in a second, but to explain where I'm going to put this lacrosse ball or tennis ball, we're going to focus right about here and here, okay? See how my thumb this is a tight band of tissue here? That's really important for stabilizing my femur or leg bone. So I'm going to focus here and here. There's not a lot of tender spots through the glute max, so we really don't want to avoid that. I want to roll up through here into the side. That's going to open up that hip, which I'll show you in a second, and allow you to use those glutes to more of your advantage. So I'm just rolling on the side, finding position, pinning it, maybe for about 30 seconds. Just holding it here. Good. And now, once you've done that, fast forward, let's just say I did that for about 30 seconds. I'm going to come up here and I'm going to hit a pigeon stretch. Now, the thing I want you to realize is the position of your foot and knee will dictate the stretch. So if I'm a little lower here, I'm going to feel it a little bit more back here. If it's a little higher here, I'm going to feel it more on the side, okay? It depends on what you're going for. That's what's going to tell you where to put your foot and your knee, okay? So I get a lot of tension personally right on the side here, so I'm going to bring my foot up a little higher, and I'm actually going to come up over my knee here and just let my body weight sink in and drop me into this hip a little bit more. As you can tell, I'm also side bending just a little bit. I'm falling into that tissue right there. Good. Now, so we just did the rolling, we did the stretching, and now I want to show you that little mobilization technique that comes with the stretching, okay? So we're going to hop up. This is called a hip shift. So when I'm talking about getting into the hip, which is incredibly important for any single leg task or living your life, I mean we're getting into our hip. So if you think about sports, you're being athletic, if you're shifting, you want to be able to shift into your hip, right? I'm shifting here. If I cut or I move, I want to be here. I don't want to be here because then you're just going to fall over. Same thing here. You want to be here. You want to be able to go here. That knee is like a post under your leg, and you can shift a little easier. So we're going to use that as a mobilization drill. We're going to come here. All I'm doing, shifting into my hips. This leg straightens, I'm stretching this side. This leg straightens, I'm stretching this side. My knee always stays over the middle of my foot. It doesn't come open. If it comes open, I'm defeating the purpose of the exercise. Here, here, here. Just like that. And it's a nice stretch to these areas of my hips, okay? Opening up these areas of your hips is key when you want to do anything like squat or deadlift or clean or snatch or whatever you're doing in the gym, okay? Now let's talk about stabilizing. There's a couple things I'm going to do here. The first is the toe tap. I'm sure you've seen this before. If you watched the plantar fasciitis video, we're getting the hips to work again. We're getting the hips to stabilize. So you've rolled, you've stretched, you've mobilized, and now you want to stabilize, okay? Get it back up. Here. So, I'm going to tap. My knee is over my foot. I'm into my hip, okay? Good. 8 to 15 reps aside, a couple times before you work out is a good suggestion. Just like that. Remember, you're always shifting into the hip, and your body weight is on top of that stance foot, okay? Now this last piece, which I'm going to use the kettlebell for, is more of a pelvic positional drill, because a lot of times you get the pain in the front of the hip because your femur, your leg bone, is contacting your pelvis and it's grinding, okay? That tissue doesn't like it, it gets really angry and PO'd. So we're gonna grab our kettlebell. So all we want to do here is practice going down in neutral. But remember, we don't wanna be open because that's gonna increase the ability to grind your hips, okay? We don't wanna be like this. We wanna be here, and we want to go down straight, okay? With this just allows us to go down a little bit straighter because we're front loaded here. Here. And you don't even have to go down all the way. It could be here as long as you're going here and you're not trying to lift your chest on the way back up. You're here and you just push straight up. Here. Push straight up. Remember, every time you extend, you risk impinging, okay? Which is going to cause that hip pain, okay? If you have any other questions, comment below on this YouTube video or send me an email to support, SUPPORT, at element26.co, and I'll answer all your questions, sets, reps, anything else you have about hip pain, impingement. Let me know. Thanks.